Okay, I think we're just past 7:30, so let's get cracking. Welcome to everybody. Lovely to see all of you. A special welcome to our guests from the United States of America, Keith and Madhu Gammon. Keith and Madhu, hopefully Keith will join us. Is he joining us? I hope so. So welcome to them too. It's lovely to have you all again. And without much ado, I'm going to hand over to the speaker. The speaker needs no introduction. Daleep Mukarji from the batch of 1964. Daleep was instrumental in setting up RUHSA, which is now one of the beacons of the institution. And I think the institution has a lot to say, to be thankful for, and to be a lot of gratitude to Daleep for setting up what is now a really superb part of the institution. Daleep came to RUHSA in 1977, the year I started my medical training. And I remember as an undergraduate student, Daleep came and spoke to us in some of our community health orientation programs and immediately made an impact on all of us when he told us about what RUHSA was going to be and what his vision for RUHSA. And we were very fortunate that we were one of the first few batches to actually go to RUHSA as part of our internship and spent a month there. Vino and I both went there. And one of the highlights of that posting, apart from seeing the development of this, was the interns were invited over to Daleep and Azra's house for a meal. So we had dinner with them, and we always remember that evening with Daleep and Azra, which was a lovely evening. And then needless to say, Daleep, after setting up RUHSA, went on to reach even greater heights. Went on to the CMAI in Delhi, worked there for 9 years and led the CMAI. And then from there, stepped up even higher to the World Council of Churches in Geneva, and then moved on to be the director of Christian Aid International, which is probably, if I'm not mistaken, I think Daleep may have retired from there. So did a great job with Christian Aid. And we're proud to have him as one of our alumni, and really privileged that he could spend some time and speak to us today. Basically, what I told Daleep, what we'd be interested is actually how this whole thing evolved as a concept and how it started and how he took the whole project forward. So Daleep, thank you very much uh, for coming over and speaking to us, and over to you now. And we're looking forward to hearing the evolution of RUHSA from the founder.
Daleep, you need to unmute yourself.
Thank you, Darren, and thank you to everybody. Believe it or not, this is the first time I'm speaking about starting RUHSA ever since I started RUHSA publicly. And so it's an unusual experience for me. Very quickly, it's a very personal journey, and it's very informal. I will do this from memory, and I will do this quickly as possible, giving as much time for questions. Next slide, please. I spent 8 years at CMC Vellore and loved it. Made some very good friends. And while I was at Vellore, I jokingly tell people one of the few things I passed first shot was public health or community medicine. And I began to see how much potential there was. Next slide. I left Vellore in 1972 to do my bond in the Church of South India Medak Diocese, first in a leprosy hospital, second in a general hospital at Medak, and then back in a community health program. While I was doing this posting, things happened to me. I saw for the first time in my life, seriously, the poverty, inequality, injustices, and discriminations in India. I'd grown up mostly in the city, and I had no idea of how bad it was and how women were treated. And that really made an impact on me and made me angry. It made me make choices as an Indian, as a Christian, and as a doctor, that I would do public health or community medicine. I would be involved in issues of justice and poverty development, poverty eradication and development, and I would like to work in a Christian setting. My boss was a medical missionary from the Methodist Church, the Reverend Dr. Frank Davey, a very famous nephrologist, but an outstanding doctor. And he influenced my life at that time. And he got me scholarships, next slide please, to come to Britain and study here. I spent 1 year at the London School of Hygiene and Tropical Medicine, where my tutor was Dr. William Cutting, and became a very good friend of mine since those days. I knew him in India and saw his work there, but it was wonderful to work with him and over the years to get to know him and Margot. My dissertation at the course that I did at the London School of Hygiene was Health and Development, a model for India. And I began in my research and work over there to see that health was both a means and a measure of development, that you could not improve health in a rural community without economic and social and other activities, basically good development programs. And so I then went to the London School of Economics to study community development for social planning for developing countries, again on a scholarship. And then I was ready to return to India in 1976. Next slide, please. I had the privilege of, with Dr. Frank Davies' help and guidance, to consider various options in India. CMC Vellore, through Dr. LBM Joseph, sent a message to me that they would like me to come back to CMC Vellore. My wife and I immediately said, certainly not. I had no intention of going to Vellore. I wanted to go to a rural program and do health and development there. I didn't think Vellore actually wanted to do that. But Frank was very good. He was the chair of the Friends of Vellore. He said, Daleep, if FOV paid for you to go to India, would you go to other places that you applied to and also spend some time in CMC? Well, that was tempting because I hadn't been to India for 2 years. And I decided to accept that. And we came to CMC Vellore and talked to LBM and a whole lot of other people. And then I wrote a proposal. I called it the Rural Unit for Health and Social Affairs, the beginnings of RUHSA, RUHSA. That is the chapel built by Laurie Baker or designed by Laurie Baker in the campus of Kavanur, which is in KV Kuppam. This campus had a leprosy program for many years. Subsequent to that, there was a nursing training program there. And believe it or not, I did 2 weeks of posting in this place in my internship as part of my program in community health. This chapel, as you can see over here, had no roof. It had trees in the middle of it, very unusual, but very rural and very appropriate. And I never thought I would come back and spend 8 years in this campus and in this work here. But we chose this campus because it's 18 acres. Next slide, please, to start the program for RUHSA. I came to Vellore in 1977, January, and my tasks were threefold. First, to start this health and development program literally from scratch. Second, to use this as a training program for nursing, medical, and other paramedical students and explore other courses. Third, to raise the resources for the whole program, the capital development and the running costs. There were these seed funds from the Friends of Vellore through the Vellore Rural Communities Trust. And I had that money to cover my basic work in the beginning. But LBM and the management told me, you have to raise money because Vellore had gone through the strike in 1976 and 1975. And so I was told, don't expect money from CMC Vellore. Next slide. Campus of RUHSA was at that time called the Rural Health Center. This was the first team of people I got together, people who helped me start RUHSA in the rural communities there. We work with people who were medical in that team. There are 2 doctors and there are social workers and 2 administrators. Next slide. What are the problems of rural India or the problems of KV Kuppam where we were locating our program? KV Kuppam is a block. A block is a unit of developmental planning in India. And it normally is very rural and it's people who are, as is implied over here, having these kinds of problems. Childhood morbidity and mortality was high, malnutrition was bad, There was poor sanitation and lack of safe drinking water in the early 1970s. The status and health of women was very bad. And there was a growing population with an urgent need for birth control. In all these areas, as I saw in Medak Diocese when I was living and working there for doing my bond, poverty, inequality, discrimination, and injustices were rampant. There was this poverty trap. People who were poor stayed poor. They didn't have the education to get jobs. They didn't have the contacts to be able to get things done for their communities. So people just stayed poor. And the caste discrimination was something that I hadn't experienced personally in my life. And to see that in the rural areas and how the rich and the high caste control the lower caste was very shocking for me. Next slide, please. Now, this is KV Kuppam. It's the block which is about 25 miles from the campus of CMC Vellore in Bagayam. It is on the north is Andhra Pradesh. Through the block goes a railway line, the line that goes from Chennai to Bangalore or to Kerala, and a road. And essentially the villages are either side. Next slide, please. KV Kuppam block is, as I said, a typical rural block. It had a population of about 100,000 in about 100 villages, and its area was 180 square kilometers. The people below the poverty line was 75%. The number of Dalits was 24%, and other backward classes or communities, another 50%. So it's mostly backward or lower caste community of Dalits. Literacy was bad for women and not too good for men. And the crude birth rate, crude death rate, and infant mortality rates are given there. We did that survey in 1978 and then again in 1983, some of the facts to show what changes took place. Well, I'll come back to that later. Next slide, please. What were then the components of the RUHSA program? Essentially, because I had done this in my training at London School of Hygiene and Tropical Medicine, it was the basic principles of good primary healthcare, which were all written up eventually in the WHO UNICEF conference in Alma Ata in the then Soviet Union to tell us what were the basic principles of a good primary healthcare program. Essentially, you want to have village level workers, then another level of workers, and then primary health center, and then secondary and tertiary care to support you. So that was what we developed and designed for RUHSA. With that, we had agriculture and animal husbandry programs because that's what people did for income, either as landless laborers or small farmers or a little bit bigger than that, but they all had something to do with agriculture or the animal husbandry. Socioeconomic activities was important to us because we believed in income generation. If we were going to get people out of poverty and improve their health, we needed to do something about income generation. And also we wanted students to come to us because that was the original reason for the law starting this program. So nursing and paramedical students came. Next slide, please. I'm going to go quickly through some of the slides about the work. Here's good antenatal care. And you'll see this next one, please. I learned at Jamala Madugu from William Cutting and also from David Morley about the under 5 clinics. And so we tried to start that in RUHSA, looking after children. Next one, please. We'll see immunization to see that every child got properly immunized in the basic areas that were needed. Next slide, please. Good health education. This is the RUHSA Health Center where one of the nurses is giving a health education talk. Next slide, please. This was the simple RUHSA ambulance that we had in the health centers behind. You can see the RUHSA Health Center there. This was used to take mothers and their child after birth back to their homes or sometimes bring a patient so that we could get people safely back to their home after their delivery. Next slide. This is the nursing students and others doing some health education and community education in the village, one of the villages there. Next slide. These were the village health workers who we called family care volunteers. one woman, all from their own community, trained by us to do the basics of maternity and child health in their own community. And we gave them the support, we gave them the context, and we gave them the training. These were essential to our approach to primary health care. Next slide, please. Besides primary health care, we started doing things in agriculture and animal husbandry. This is layers. You'll see this later in a video. Next slide, please. These are people working during the drought relief programs. We had food for work programs. We're helping people helping us to do the watershed management so that water could be, if it came there, we used to say, harvest the floods to feed the drought. We could get some heavy rain sometimes, and the rain would run off to the and we would never be able to. So this is part of that program, getting the local people and paying them with food to do the job. Next slide. This is from the cows that we had. We started a gobar gas plant from which we got gas to do the cooking for them in the mess and the canteen that we had, a biogas unit. Next slide, please. This is one of the vocational training programs. We did it for men and for women, cycle repair shops, where then we got banks to give loans for them to start a cycle shop in their own village and rent out their cycles. We did, and to repair them and to look after them, because we had a community college at the back of the campus of the RUHSA, where we trained men and women in different aspects of things and got them loans from the banks so that they could start to stand on their own feet. Next slide. You'll see this is the Weavers Cooperative. It was quite big in rural in KV Kuppam that many people were weavers, and we helped them not only to develop a cooperative, but also to, and you'll see this later when I talk about the Bishopton Kuppam link between us and the an area in Bristol, how tailoring was done, and how also we got silk manufacturing or silk things growing in the area, or to get, because people had a talent and experience in weaving, and tailoring. We wanted to develop that in a more professional and commercial way. I will now take you into some slides, into a video. Ruth, if you're ready, can you show the video now, please?
Is this working
And
now?
the hospital's gone further
Yes.
to tackle the question of food availability itself. This man, Dr. Daleep Mukarji, has been put in charge of an ambitious project called RUHSA, which aims to combat disease by improving both the quality and quantity of food available to the people of the area. Currently, the reason why children get so little milk, for instance, is because the village cows give so little, about 1/10 as much as Western cows. So a crossbreeding program's been started, and already it's producing cows with triple the previous milk yield. Eggs, too, have been luxury items till now. But through the hospital's RUHSA and Community Health and Development Program, and with the support of government agencies, chicken hatcheries have been established in a widening circle of villages, and many more children are having their diet supplemented by eggs. Again, with the help of government departments and the banks, the hospital's RUHSA program also provides financial assistance and expertise in water management projects, and with the provision of fertilizers and pesticides, and machinery for power spraying, tilling, threshing, and many other agricultural purposes is hired to farmers at a nominal charge, and training is given in its use. Training's also given in the growing of new or improved crops, and through demonstration plots set up at RUHSA headquarters and in village fields, farmers can see for themselves the advantages of crops like kababo, a drought-resistant, fast-growing fodder crop. And here, beneath these palms, we find perhaps the most valuable new crop of all, mulberry bushes, which thrive on this previously unproductive soil. Silkworms, supplied by RUHSA, do the rest, converting the leaves into something far more valuable, silk, that the village folks sell at a good price to buy food. But all such efforts to raise living standards could so easily come to nothing unless equal attention is given to the question of birth control. For the current birth rate of 1 million new babies a month seriously threatens to undermine all efforts to raise living standards. So at village level, at urban health clinics, at the rural hospitals, and in the main hospital, great attention is given to this vital matter. Each mother who comes in for childbirth is taught family planning methods and is reminded of the economic problems large families create. And mothers who already have 2 or 3 children above the age of 5 are offered something few today refuse: a free sterilization operation before leaving hospital.
I'll just get your slides back.
Okay, thank you, Ruth. That was just a bird's eye and quick view of the health and development activities. Let me then try to tell you what were the components of our success, because we did measure in the first 5 years what difference we had made in the community and what we were doing. I think these were the factors. We had a well-developed, integrated health and development program with good plans, with clear objectives. We had very good cooperation with government department, local banks, and others. And we emphasized in health and development, women and children. We believe that without improving the status and health of women, you were not going to get a difference either in the health of the children or the families or of the development of the community. Community participation was right throughout, right in the village level health workers, in the community programs, youth clubs, women's clubs, cooperatives, and a host of other self-help groups. We wanted to work with the people to help them help themselves. And we believe very strongly that staff had to be trained with the right attitude and support to do the work. And we had these special categories of health workers that I took the trouble of training in my first year, 16 of them, 1 in each of the main villages, called rural community organizers, 1 man and 1 woman in a village together. And that living there and working there, these were all people with masters in social work who there were so many of them unemployed, and I got them on and trained them and used them right till the time I left. Next slide, please. This is just to show you that we then wanted to get this program recognized by government, by the banks at the national and local level. And we instituted a thing called RUHSA Day in January to commemorate the starting of it. And the governor of Tamil Nadu was there in 1983. Next slide. You'll see me opening. Water was very important in economic development and also in our health work. And I got an agency that was actually a Christian agency that helped us put over 200 deep bore wells in various parts of KV Koppam. Water for the families, for the children, for the animals and animal husbandry work, and for the agricultural work. It was very, very important. And I think that was important to us. I knew that the Pala River, which was at our southern border, had this underground water which supplied the whole of Vellore and everything else. Why couldn't we also get some of that here in KV Koppam? Next slide. So I had the privilege of excellent and good relations with CMC Vellore and a lot of support. The director personally and his administration supported me. Various departments helped me with the work and the research in a variety of ways. Some would come out and help in RUHSA. The College of Nursing sent their students and staff to us regularly. The links that CMC had and I had with funding agencies and organizations all over the world helped us to raise the money for the infrastructure, the hostels, the program, and all the things we were doing. And CMC's reputation got me access into the banks, into the companies, and into various businesses, which helped us in a variety of ways. It was impossible for us to do this alone. I mean, it was unbelievable that we had an agreement with the government of Tamil Nadu that their local primary health care center came under our management while I was there. They didn't like it at the PHC level, but at least we were supposed to guide them. So we didn't have a government health service and our service. We tried to integrate that. Next. What are other things that I talked about? Weavers, dairies, tailoring, broiler, and layer unit cooperatives, all these different things, trying to get them to develop ways for their income. There was this huge watershed management program that I got in collaboration with Tamil Nadu Agricultural University and others to help us look at how we could use water. We put down about 2,000 to 3,000 trees to be able to say on the hilly parts of the KV Kuppam area to do things around drought relief. We started various training programs. One was the Diploma in Community Health Management. We started this rural community college for apprentices and training. And people, as Tamil Nadu developed and Chennai developed, people came to us to get people to work in automobile or electrical jobs because we did their training and they knew that our certificates were going to be, and the boys or girls were good, trained by us. We developed this link with Bishopston in Bristol in the United Kingdom. Some of you might have known about that. It's now linked to the Friends of Vellore. And tailoring units and cooperatives were started with their help and guidance in KV Kuppam, and the shops here were supplied things for sale here. In order to be able to put RUHSA on the map, we got a new post office on the campus of RUHSA. We got a bank opened in the campus of RUHSA, and we had bus services from Vellore and Katpadi and Guriatham come to RUHSA. Okay, next slide, please. This is just to tell you, this is the chapel. We had it developed. The roof came after I left, but the cross was something that I had put over there before I left. Next slide, please. I left after 8 years. I felt it was time to go and hand over to my successor, who was a friend and classmate of mine from Vellore, Rajathan Abel. And as you heard from Dylan, I left to these other jobs. But I want to say, RUHSA and CMC Vellore had a huge influence in my life, and I'm very grateful to God for that. I did so many things because of that. Next slide. This is the chapel, not in my time. When I went back sometime later, I saw the chapel. It's that what I thought was a unique and unusual chapel now has a roof and it's very well finished, but it's still the center of the campus. Next slide, please. What is the underlying basis of RUHSA? Two things. First, it is a Christian on Christian principles. And this is a quote which was in English and in Tamil outside my office on the wall, so that people knew what was it that inspired us. And I used to ask my staff and colleagues and myself, what can be in this context good news to the poor? Next slide, please. And then there was this famous Chinese poem that I thought undergirded the kind of philosophy we had. Go to the people, live among them, love them, start with what they know, unlearn what you know, build on what they have, involve them where possible, but of the best leaders. When their task is accomplished, their work done, the people all remark, we have done it ourselves. Our principle, how do we help people to help themselves, that they can have ownership of their own future through empowerment? Last slide. This is the farewell that RUHSA gave me in January 1985. My wife and I are sitting in the front there. And this is the administrative block that we had built at the training center. And behind that was other things like the community college and things like that. I am grateful to God for the time I had at RUHSA and the things that I was able to do there. God called me, used me, and then I felt sent from there to the other jobs I had. Thank you. I'm open to questions now. I hope I've, Darren, kept to the time you had given me. I tried my best to finish on the time.
Wow, what a visionary and what a great job you've done. We'll have general questions if anyone wants to ask questions, and like last time, we'll then break out for a few minutes and then come back in the end. Daleep, can I just start off the questions by I know you referred to this in your talk. After 8 years, you decided to move on. What was it that made you move on? Do you think you'd achieved the goals that you'd set yourself at the start? Or did you feel that CMAI came knocking and you felt that you needed to use your talents elsewhere? What made you decide that it's time to move on?
Darren, that's a very difficult question to answer, but I felt after 8 years, it was good to hand over to somebody else because the program was getting too closely identified with me personally and my ability to raise money and to lead it. I wanted to show it could go without me, and it's doing better than I ever thought it would do. And leaving it was part of my intention. I thought I'd stay a little longer, but I am grateful that I left at that time. Handing over to my classmate and friend Rajatam Abel, who ran it for many years. And I've been back once or twice, and I've seen excellent work. Some things done even better than I ever thought or imagined.
Yeah, thank you. Anyone else? Any questions that you want to ask Daleep that you want?
What is layer farm?
Yeah, there you are.
There, Alan?
Yes, you can be heard now.
Can you hear me? Doctor, I just wanted to say, Dr. Mukarji, this is one of the most inspirational talks I've ever heard. And you have touched in areas out with the medical field directly. But the way you've been able to synthesize, bring together different strands have been wonderful.
Truly.
Absolutely, because
wonderful.
Two images flashed through my mind. One, Dr. Livingston, I presume. One, and two is the Wreath lectures. The Wreath lectures, which actually address such complex things. And this is the sort of program that needs to be stored in perpetuity. I'm a gastroenterologist by profession, if you like, an eccentric gastroenterologist, but my great love was spending time at the rural hospital in Bagayan, where Dr. Benjamin was the director, and from him and all those village trips, I loved it. I just loved going around in the fields, collecting samples, coming back, doing everything by hand, and my goodness. But you actually have symbolized everything.
Thank you, brother. This is very kind of you to say all this.
It really, I just want you to.
Thank you. We were all trained by a certain spirit and a certain value system.
Yeah.
And that value system and spirit inspired me. There was a question from somebody about what is a layer unit. Let me quickly say, that is laying of eggs. Just they laid eggs that we sold.
Yes.
David, did you have a question?
I think that was David's question.
All right. Okay. Thanks. Yeah.
Any others?
Might I ask a question?
Yeah, please, Peter, go ahead.
Daleep, thank you very much. My question, you made it all sound as if it all happened so easily. I'm sure there's a lot of hard work. And I just wonder, what sort of opposition did you face from within the community? You know, those who had the power.
Well, I had opposition from various sources, including CMC Vellore itself, because, but as I said, the director gave me the freedom and I was allowed the space to do this work because they trusted me as an old student. In the community, it is inevitable. The higher castes and the richer people don't want change sometimes, and you've got to work with them and talk to them and listen to them and work with it. There were times when we had people opposing us, even the government doctor, as I told you, they growled me at one time in my office. But, that's part of the work. I mean, good development work, you have to challenge structures and systems to change things for the poor, the marginalized, the women and the weak. And we never took those opposition as problems we couldn't face. Let me be honest about that. That is part of the work.
Thank you.
Asha, did you have a question?
Daleep,
Hi, Asha.
hi, Daleep. Can you hear me, right?
Yes, I can hear you.
Thank you so much. That was an amazing talk. And having your years seeing Russo develop, it's wonderful. When you started, it seemed to have been quite an independent entity, Russo, and now department of CMC. Is that what you had in mind when you started? And what do you think the pros and cons of that particular integration have been over the years?
That is a difficult and delicate question, Asha. I never expected Russo to become part of the medical college in the way it became a department. It wasn't in my time. And that was one of the problems I had when I was leaving. I wanted it to have the freedom, because if you're going to do development work, you need to be able to challenge the people in the community and do things differently and not have to go through everything. But one good thing about RUHSA becoming a department of the medical college, it became more stable in its administration and funding, which was secure for the staff and secure for the program. And because in my time, I got little or no money from CMC Vellore. Most of it I had to raise from donors and things. So there are pros and cons. I think in the long run, it is a medical college and maybe a department. I wish they had made it the third unit of community health. And I don't know why we got 3 units of medicine in my time. We couldn't. They wouldn't give it. They wouldn't give a community health 1, community health 2, and community health 3. But that is history. I left in 1985. But I think it could have been, if it had to become part of the medical college, it has to become a training department of the medical college. It still isn't. Medical students still don't come to it.
That's very sad.
That's very sad. That's very sad.
Jeff and Joy, one of you, I'm not sure whether both had questions or one of you, go ahead.
Firstly, thank you, Daleep. I mean, wonderful presentation, vision and implementation.
Yeah.
And we can see how the vision has spread to LCECU and Chad. Are you aware of any other projects in India that have picked this kind of principle up and implemented it in this way?
Yeah, yes, Jeff. A lot of Vellore graduates have done similar kind of work, either attached to mission hospitals or something. I mean, long before me, Raj and Mabel Arole did a very bigger and better program than this in Jamkhed. And Prem and Hari John did it in Dinabandhipuram. And Ashok Dayalchand has done it in rural Maharashtra. So a lot of people from Vellore and others, I used to meet these. There was a network of us, and we'd meet under the umbrella of the Voluntary Health Association of India and be able to talk to each other, learn from each other, and give guidance. But not only Vellore graduates, there were other people from the Medical Friends of India. I think that was the organization. Yes, there are others. And these principles were being put into the government planning and procedures.
Hi, I'm Jaya. I'm from the batch of 88. And I really want to say it was such a wonderful talk. Couple of things I wanted to say. Really amazed by the work that you did. As a medical student I can't remember when, but we did go to RUHSA. So we did stay there, but didn't quite realize that, they had done so much of community empowerment. So I am totally impressed, much more than what I knew at that time. I also want to highlight one of the previous questions. In fact, my classmate Shobha and Ravi had come here to UK last year. and they did show us a slide, show us a PowerPoint, and it's called Asha Kiran Hospital, I think, in Odisha, and they do similar kind of work, amazing work. So I'm sure take an inspiration from pioneers like you all. I'm really thankful for the work that you have done.
Thank you, Jaya. Yes, a lot of fellow graduates are doing this. I'm not the only one. I don't want even to claim that, but I'm glad Shobha and Anna are doing that. Okay.
Also, please go ahead, Joy.
Just to ask, what was the reaction of men in the community as you began to focus on the women and children and raise the position of women as you got work for them?
Joy, there are always problems. Before I talk about men's reactions, one of the biggest forces I had to deal with was with mother-in-law and grandmother who thought, don't tell my daughter or don't tell my daughter-in-law what to feed the child, how to immunize. Don't change the practices. So we had to try to bring them in, and that is why village health workers who were themselves mothers and village women were helpful. And to the men also, we had to, when I first started off by talking up, I kept asking them, what do you want? They all said, look after our women, look after our children. They thought because I was a doctor that I will start little hospitals in all the villages. And I said, no, we don't need hospitals. We need just good health education and primary health care. In 4 or 5 years' time, your children and your mothers, your women will be better in health. And I think that was important. But also to see that the youngsters were going to get jobs or training or their agriculture. I remember going to one village when I went to see a little child over there. And then I saw the man came and said to me, sir, can you look after my cow? I said, I'm not a doctor of cows. I'm a doctor of children. I might be able to do that. But when he saw that we were willing to improve the quality of the cows and the milk production, and we were able to improve on goats or other things, they saw that we were committed to the community and committed to change and development. Of course, there was some opposition, but that's part, as I said, it's part of the work.
Arpu, you had a question, Arpu? Do you want to go ahead?
I'm from Arpudraj, batch of 84. I think we have Shanti, who is the present director of RUHSA here. I think she can probably want to say something. I don't know whether she wants to say something.
Hi, Shanti. I didn't know she's
Shanti, I didn't realize Shanti was on the...
Yes, she's my classmate. She's there, actually. I think she's probably...
Yeah, she provided some of the slides I need. Where is she?
Shanti, are you lurking in the background somewhere?
Yeah, obviously, I had to wake up from sleep, so I'm not in a presentable position to show my face. I'm sorry.
No, don't worry.
Do you want to say anything, Shanti?
I just want to say that it's really a privilege to be in RUHSA.
Yes, lovely.
Yeah.
Thank you. Yeah, that's great to hear.
I went and saw her over there.
And something that one of the Chinese proverb that Daleep actually put up, the poem, it's interesting that I have witnessed how people have taken over the development themselves. Because what I see now is the people don't remember when it started, was started by RUHSA. There are a lot of things in the agriculture practices I have seen now, which just people take it for granted. They say, we are doing it this way. I mean, that's great to hear that. We are doing it this way. They don't remember RUHSA starting it. That is what it's supposed to be. And when I heard that, when I saw that, I told people, my colleagues who were with me, I said, that is what we want. That's our success. And that is what we see 40 years down the line. And it's really great to work in KV Kuppam at this point in time to see some of the efforts that have borne fruit. But another point to say is there's still a lot to do, and a lot of things that are still, they need changing the transformation that we hope for in people and in communities. Thanks.
Appreciate you joining us in spite of it being the early hours of the morning there.
Morning.
Yeah. Ashish, did you have a question, Ashish?
Yeah, it was actually just to tell Daleep that I worked in PMR till 10 years ago, and a lot of what you started influenced our work when we were, for instance, providing vocational rehab to people with spinal cord injury. They learned tailoring and cycle repair, and it made huge inroads into helping them to become independent. And also our work was linked up with RUHSA, and we were able to then learn from the way the people with disability in RUHSA interacted with RUHSA, and we were able to import that into our work in PMR. So the work had a
That's good, Ashish. Thanks for sharing that.
Dayalan,
Chandu, yeah, did you want to say something?
Yes. So, may I make a suggestion which will be financially helpful? One, you working with a first-class journalist to produce a book. Sell it for whatever price is there, enough to make profits. Because this is a message that comes from the heart, as opposed to from the banks, where, and it's just something with all these illustrations, it just brings to life the whole thing. You can even provide a link to the movie and to your talk.
Daleep, are you hearing that?
Was there another question?
Daleep. Yes, I would like to ask Daleep. You're bound to have had statistics on what the effect of the program and say maternal mortality, birth rates, child health, infant mortality. You must have been, I'm sure you would be measuring those things. Do you wish to just give us a little flavor of what you found over those 8 years that you were at RUHSA?
Thank you, John. Yes, I did show that infant mortality rate came down. When we started, it was 116, and in 1983, it was 65. Childhood morbidity and mortality also came down, and we documented this and published this in reports in that area. We also used another block as a control block for ourselves. So yes, we did show not only in health, I was only pointing out the health, but also in women's literacy and education, improvement of the things, because to show to the people and to others that things were improving, we had to measure a few things as the basic things.
Yeah. Thank you.
More questions before I think we bring this to a close. Andrew Patterson and then Isaac Bhupalan. Andrew, do you want to go first?
Oh, thank you. Actually, the question's been answered. I was going to ask about literacy rates, and they've obviously increased. But I also want to say thank you because I visited you in 1983 and you really inspired me as I went back to England. So thank you.
Thank you. Thank you, Andrew. I'm glad you got inspired.
Yeah.
Isaac?
This is Passion Week, and one of the things, simple statement that Daleep made really fired me up is, I put the cross in the chapel, and I see a range of crosses behind you, sir. I would like to really hear what is the impact of what it's been on your life, and why did you put the cross in the chapel at RUHSA?
First of all, there was no cross. There was only a picture. I don't know why, Isaac, that I wanted to have it. And just as a thing, the carpenter asked me, how big do you want the cross? And I said, well, as big as it could be to crucify somebody. He didn't understand that, because, so I lay on the floor. I said, now measure me and imagine you're going to crucify me on this cross. So that cross was designed to take a person of my height And also I wanted a cross that didn't have anything on it. If you went closer, there are nails, just nails left there. I wanted people to know that the church and the Christian side of our work was important, because there was a lot of opposition in the beginning, that because we were part of CMC, we had come into the villages to make people Christian, or to help only Christians, or to, in different ways, give jobs to Christians. And I had to show to them, we are here because we are Christians. We are not here to give jobs to Christians, not here to help Christians, not even to make people Christian. And I think by the time I left, they began to understand that and accept that. But in the campus and in our work, we were Christian.
And the collection behind you.
Oh, that's another story. I have got a collection of over 100 crosses from all over the world. One of the things about traveling with World Council of Churches and Christian Aid and India is I collected crosses from all over the world. And I have a collection of them downstairs in my room and in all over the place. And I study crosses, Ethiopian ones and Latin American ones and all. That's just a hobby. Because my wife said, no more things from all over the world. This house will become a museum. You're given one wall, and you can put things up on the wall.
Thank you.
Thank you, Daleep. That was absolutely fantastic. Thank you for an awe-inspiring insight into the evolution of RUHSA. Really fantastic. Thank you so much.
Just look at what all you got.
Yeah, I know what I got. It's a huge thing that when people talk about standing on the shoulders of giants, I mean, I understand that.
Yes, yes.
Really.
Great. Okay. Thank you. I hope you all enjoyed this. A huge thank you to Daleep for really inspiring talk.
Absolutely.
So beautiful. Thank you.
Our next meeting is on April the 29th. Our speaker for next meeting is going to be Hugh Skeel. Hugh and Debbie are here in the UK on holiday. Most of you will know that Hugh works in the department of development office. Yeah, he manages the whole development office. So
yes.
Hugh and Debbie are here, and Hugh will speak to us next week. So thank you all, and have a good rest of the month, and we'll see you all in a month's time. Thank you, Ruth, especially for coordinating.
Thank you, Ruth.
And a huge thank you to Daleep.
Thank you.
Thank you.
Thank you.
Happy
Thank you very much.
Wonderful.